Joining us now to break this all down, we have Dr. Anahita Dua, founder and chair of Healthcare for Action and associate professor of surgery at Harvard University. Dr. Dua, good to see you. And what is your reaction to learning about this new initiative, this fast action on cell phone radiation, cancer, and health?
Thank you very much for having me. It's a pleasure to be here. When I heard first about this, it was interesting because there is so much data that has already been published from the WHO, from the FDA, showing that there is no connection between the type of radiation, which is non-ionizing radiation that comes from the 5G cell phones, and any connection with cancer, any connection with any sort of neurological issue. So it was a surprising thing that RFK brought this to light to decide to focus on it with the money that we have.
Interesting. Do you not agree with the initiative?
No, I do disagree with the initiative primarily because we have so much information about it. I am a vascular surgeon and I deal with radiation constantly. So there are two types of radiation that we need to focus on. There's ionizing and non-ionizing. Ionizing radiation is the bad stuff, the CT scan that can give you actual breaks in your DNA and indeed cause cancer. Everybody knows that. Non-ionizing radiation, which is what we see from the cell phone towers, actually at high frequencies cannot even penetrate the skin. And again, there's a substantial amount of data that shows that there's no association. In regards to what you mentioned about a number of states banning schools and cell phones in schools, really that's about kind of social engineering and ensuring that kids don't have phone exposure while they're supposed to be in class. It has nothing to do with brain cancer, which is what this connection is seemingly about.
Yeah, tell me more about that, because we have heard about these sort of anecdotal evidence, individual case studies of women who carry their cell phones in their bra, for example, and develop breast cancer on that side. We've seen case studies of people who talk on the phone right against their ear for long periods of time and get maybe a parotid gland tumor in their face. Are individual case studies not enough? Does it not rise to that level to warrant funds being put into a full-blown investigation?
You just summed it up beautifully. Exactly. Not to make light or be dismissive of those types of cases, but the fact of the matter is that that same woman who put a cell phone next to her breast also probably had coffee every day of her life for the last 10 years. We can't just say that, oh, coffee causes cancer, or she drives a red car, so that causes cancer. That would be very dangerous, because what that would do is create hysteria and fear, and that's why science is done in such a specific way. So it's important to take away all what we call the confounders and say what else could happen. Breast cancer is extremely common, for example, so it may have nothing to do at all with the cell phone being in that location. And the correct way to study that would be to take a certain number of women, all who had their cell phone up against their breast, and say who got cancer and who didn't. It's appropriate to ask the question. It's appropriate to study the question. It is not appropriate to generate fear and hysteria and to waste time and money on things that have already been clearly debunked.
There is some evidence that some cell phone companies may not be fully transparent or fully disclosing the full level of cell phone radiation coming out of their devices, or potentially talking about real life usage, so really being 2 millimeters away from it versus having it far away. What would you say to people who are concerned about that?
That's a great point. Again, and as we have differences in cell phone companies and we have new data that's coming out, it is appropriate, again, to ask those questions. But we can't basically grind the world to a halt and restudy repeatedly the same thing over and over again. At this point, the most important thing is that right now we're saying things like, oh, higher frequency, and therefore this may cause damage, because that's the difference between 4G and 5G, higher frequency. But actually we know from physics, this is not political, just physics, that higher frequency penetrates the body less. So it's actually the opposite. We should be saying that lower G, if anything, might be causing an issue if we wanted to study that. So it's important, again, to frame the question correctly and not just say, again, that the world is going to stop and we're going to keep rehashing the same questions without a better way of approaching it.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.